balance is important to stay upright, maintain equilibrium, and see movement. When that isn't working right, people can get dizzy, and sometimes it can affect hearing. Joining us now is Dr. Andrew Liu with the Ear, Nose, and Throat Clinic at Mercy Medical Center in Cedar Rapids. Thanks for joining us, Dr. Liu.
Thank you. I'm glad to be here.
And tell us, where does our sense of balance come from?
So some people may not know that the inner ear actually serves both hearing and balance. And so in addition to hearing, the inner ear helps sense head position and body position in space. And so the brain actually combines the inputs from your inner ear with your vision and your body's position sense to help keep you upright and keep your eyes from bouncing around when you move about in the world. So
right, you wouldn't think that would be connected, but it all is. Where are the signs and symptoms of balance disorders?
So one of the primary symptoms of inner ear related balance disorders is vertigo. And so vertigo is where you start feeling like the world is spinning on you, or you feel like you're spinning even though you're not really actually spinning. And so this can make you sick to the stomach and make you vomit, and sometimes this can be associated with hearing loss or hearing changes, increased in your ringing in the ears, and also ear pressure or fullness. So those are things to kind of watch out for.
Are balance disorders common, and who is most susceptible?
That's a good question. So balance disorders are quite common. It's one of the most commonly things that people seek care for with their primary care physicians or through the emergency room. And so one of the most common, or the most common cause of vertigo is BPPV, or benign positional paroxysmal vertigo. It's a very long term. But it's where the crystals or otoliths in your inner ear become dislodged and you start having short-lived bouts of vertigo when you're turning over in bed or bending over. And so this is a very treatable type of vertigo, and most frequently is in females, but obviously can affect males, and usually presents in their 30s or 40s, but obviously can affect folks that are older than that as well.
And you said it was treatable, so what does the treatment look like for that?
The main thing for treating vertigo is getting evaluated by probably initially with your primary care doctor, mainly because there are other causes for imbalance that need to be ruled out first. So things such as cardiac abnormalities, heart rhythms that are abnormal, diabetes can actually cause imbalance, and also problems with the nerves that are in your legs. And so getting that evaluated first is important. But patients with room spinning vertigo, obviously would need to be evaluated by an ear, nose, and throat doctor. And so at the Mercy Ear, Nose, and Throat Clinic, we have a team that we take a team approach to treatment and evaluation of vertigo. So we have audiologists that test your hearing and balance. My colleagues and I take care of ear disorders that can cause vertigo, and we have a physical therapist that does focus on vestibular and balance therapies.
You want to be steady on your feet with wintertime coming up.
That's
Dr.
right.
Liu, thanks so much for joining us here today. And stay with TV9, we'll be right back.